So in this video, we're going to do a brief introduction to the Vivo 55 ventilator. The Vivo 55 is intended as a life support device. It can be used for invasive ventilation, for non-invasive ventilation, and for CPAP support if needed. So the Vivo 55 is being rolled out across the country during the COVID-19 crisis. So in this video, we're going to do a walk around the outside of the device. We'll look at the left-hand side panel, the right-hand side panel, the main screen, and the rear of the device as well. We're just going to have a quick run through the left-hand side of the ventilator. If I just compress the clip to take off the cover, you'll see under there we have two filters. We have a coarse grey filter, which you should check on a weekly basis and wash with warm water. And then you have the white filter, which should be checked weekly but changed on a monthly basis. During COVID-19, we would advise that these filters are changed in between patients as well. You'll see that you just have to stack one filter on top of the other, and then we can line up the cover at the bottom and then just offer up the cover until it clips into place there. Running around the rest of the left of the ventilator, we do have a cooling fan filter under here. You can take that panel off again to wash the grey filter that sits under there on a weekly basis. Rest of the side of the device, so the red inlet is for a remote alarm unit or a nurse call adapter function. We have a USB input, so the device can be plugged into a PC software platform, and we can live view patient data and download summary information. And we can also do that via the memory card insert there, so you can look at summary information and detailed 24-hour data on the PC software that way as well. At this time, we're just going to go through the right-hand side of the Vivo 55. So I just want to first point out the main on-off switch on the side there. If you press that button once, the device will come into its standby mode. To attach the mains power to the Vivo 55, we would just put the lead into the side of the ventilator, like so, and then we would bring the latch round so it's clipped safely into position. You have a 24-volt DC connection there, which you won't be using in the hospital environment. Your main air outlet is on the rear of the device. Okay, so you attach your breathing circuit here, and this port is for your oxygen entrainment. So you would need the oxygen adapter, which just clicks into place like so, and then you can put up to 15 litres per minute through the device as per the instructions for use, but during COVID-19 you can go up to 30 litres per minute. We have verified the device as safe to use in that manner at this time. The connection that you can see next to the air outlet is for attaching the proximal pressure line from an active valve circuit. Just to run through some of the monitoring options that will be used with the device. So the white connection here is to attach your FiO2 monitoring sensor. So again, we'll come to that setup a little bit later. The yellow connector is for your end-tidal CO2 sensor. So we'll see how to connect that into the tubing and back to the device. And then the blue connection is for your pulse oximeter. The green connection is for a remote start-stop function, which during this time you would not be using in the hospital environment. On the underside of the Vivo 55, we can find situated the internal battery, which will give you 4 hours of backup. You also have some additional cooling fans on the top here, so please make sure these are not obstructed at any time. So just looking at the main interface of the Vivo 55, we can see on the bottom here we have a series of menu navigation buttons. You'll be able to go into your setup and alarm and monitoring options through these when we switch the device on. The button on the front here is your start-stop treatment button. This is your alarm silence or audio pause button. We have on the right-hand side our navigation buttons, so our up, down, left, right functions. So you'll be using these to lock and unlock the clinical settings and the home mode, and also to change clinical parameters and alarm settings. The button on the bottom right here is your information button. So if any alarms are sounding, you can press this and a short message will appear on the screen to give you the potential causes of those alarms. Important to note, the Vivo 55 screen is not a touch screen. All of it is controlled via the menu buttons and the navigation functions on the right hand side. The lights that you can see down the left-hand side of the interface will show you what power supply you're attached to, whether that would be the click-in battery on the back of the device, which we're not using, the internal battery, which you may be using, the DC supply or the AC power supply. So the light on the top left, when that is flashing, that's an indication that the patient is triggering their breaths effectively. And then we can see the lights in the bottom left, which relate to the alarm functionality. So you can see when those are flashing and when the alarms have been silenced as well. So in terms of the advice for cleaning the exterior of the Vivo 55, we would suggest to use a mild detergent solution, and then you can wipe down the outer casing. It is protected from any water ingress through any of the buttons, so you shouldn't need to worry about that. And just be sure to wipe down all surfaces on the outside of the ventilator in between patient use. So in summary, what we've covered here is a quick walk around of the Vivo 55 ventilator. We've looked at the left-hand panel, the right-hand panel, the main interface, and the rear of the device as well.